Hello, my name is Dr. Dewan S. Raja. Today I will discuss about Kartagener syndrome. Kartagener syndrome is a rare genetic disorder characterized by abnormalities in the cilia. Cilia are tiny hair-like structures that line the respiratory tract, fallopian tube, and other parts of the body. Cilia play an essential role in clearing mucus, bacteria, and particles from respiratory system and moving ovum through the fallopian tube in the female. We know that ovum goes through the fallopian tube. It comes out of the ovary by ovulation, and cilia has essential role. Cilia in the lining epithelium of the fallopian tube or uterine tube has its important role to transfer the ovum through the ampulla of the fallopian tube from the infundibulum, then ampulla, then fertilization, then it should be implanted in the uterus. In male with this condition like Kartagener syndrome also tends to be infertile as a result of sperm dysmotility. The male will have immotile sperm, so sperm cannot climb through the cervix, uterus cannot go to the ampulla of the fallopian tube to fertilize the ovum because the sperm is unable to move because its tail don't move because of the Kartagener syndrome. Primary ciliary dyskinesia and Kartagener syndrome, these are interchanged very frequently, these two terms. So Kartagener syndrome is a type of primary ciliary dyskinesia with some feature like that of Situs Inversus as well as bronchiectasis, respiratory infection. So we call at that time Kartagener syndrome. But Kartagener syndrome is also a ciliary dyskinesia. Primary ciliary dyskinesia is an autosomal recessive disease with a frequency of 1 in 10,000 to 20,000 parts. The disease-causing mutation results in ciliary dysfunction due to defect in ciliary motor protein. That protein is the Dynein protein, that is the mutation involving Dynein. Ciliary function also is necessary during embryogenesis. So, how it works, it is not properly explained, but it is found that ciliary function is essential for embryogenesis to ensure proper rotation of the developing organs in the chest and abdomen. In its absence, their location becomes a matter of chance. Approximately half of patients with primary ciliary dyskinesia have Kartagener syndrome, marked by situs inversus or partial lateralizing abnormality associated with bronchiectasis and sinusitis. So, Kartagener syndrome is a type of primary ciliary dyskinesia where we'll get situs inversus, bronchiectasis, and sinusitis. Sinusitis means inflammation of the paranasal sinuses, particularly the maxillary sinuses. So, this is an example of Kartagener syndrome. This is a primary biliary dyskinesia, primary ciliary dyskinesia. Here, the Dynein part is missing. Like this. This is the Dynein part. This picture has been taken from Jungfried's basic histology. This is from the Polina histology. Here is the disease part. Here, this Dynein is missing. This Dynein is missing. This is a part of cilia. The transverse section of cilia. Here, Dynein part is present. This is the normal cilia. This is the abnormal cilia with Dynein. The motor protein is missing here. There is the reason for immotile cilia, immotile spermatozoa. Okay, we got that. Now, features of Kartagener syndrome. What are the features? Chronic respiratory infection due to impaired cilia. People with Kartagener syndrome often experience chronic sinusitis, inflammation of the sinuses, particularly maxillary paranasal sinuses, lung infection like pneumonitis, pneumonia, and also destruction of the lung tissue due to continuous infection. There will be bronchiectasis, situs inversus. This is a condition where internal organs are mirrored from their usual position. Like apex of the heart might be on the right side of the chest instead of the left. We get dextrocardia as a part of situs inversus. All other organ will be on the other side, like spleen is on the right side. About 50% of people with primary ciliary dyskinesia have situs inversus. In fertility, we discussed both male and female with Kartagener syndrome may face fertility issue. In male, sperm motility may be reduced due to defective flagella that needs the dynein protein, while female may flagella is the tail here, tail of the spermatozoa, while female may experience impaired transport of ova due to dysfunctional cilia in the uterine tube. Uterine tube is same as fallopian tube or sulfates. Diagnosis of Kartagener syndrome involves genetic testing, examination of ciliary structure and function via nasal or bronchial brush biopsy, and chest X-ray CT scan to assess for situs inversus and bronchiectasis. Treatment: there is no cure for Kartagener syndrome. Treatment focus on managing symptoms and preventing complication. Airway clearance physiotherapy technique to clear mucus, such as chest physiotherapy or devices that help with airway clearance. Antibiotics, regular antibiotics for infection. Sinus and ear surgeries. For sinus, we do bilateral antral wash, or we may do caldual operation. In case of ear, if there is otitis media, we may do laryngotomy. So in some cases, surgeries may be recommended for persistent sinus and ear infections. And that's all about the Kartagener syndrome, a primary ciliary dyskinesia, a type with, in 50% cases, situs inversus, sinusitis, and bronchiectasis. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.